Greetings, viewers. Today we have ZCIEA National President, who is also the StreetNet International President, Lorraine Sibanda, who has been traveling with the Parliamentary Portfolio Committee on Women's Affairs, Small and Medium Enterprise Development. This committee was conducting consultations on SMEs and informal economy on the impact of COVID-19 on the small to medium enterprise and in the informal economy on the southern part of the country from Cholocho up to Kwekwe. So, Madam President, can you share with us the details of the program and the issues that were raised by the informal economy workers and traders?
Thank you very much, Fungai. I will start off by talking about the areas that we covered in Matabeleland and Biglands up to Zishabandi. We started this outreach program shadowing the Parliamentary Portfolio Committee on Monday, and we started off in Cholocho. Along with me, we had the national organizer, Mr. Lorraine Sibanda, and the information officer, Fungai Bunetsi. We attended the Cholocho consultation, and the main issue which came out of the Cholocho consultation was that the road network between Cholocho and other areas was so dilapidated that it was difficult for people to conduct business, especially during the COVID-19 period. There was also the issue of the fact that the people did not receive the COVID-19 cushioning funds as widely as had been expected or as widely as was broadcasted. So the issues that also arose was the need for shelter for informal economy workers to operate from, the markets which do not have ablution facilities, neither do they have water. The issues raised in Cholocho were very much related to the issues raised in Bulawayo. The Bulawayo informal economy workers also raised concerns that the markets in which they were operating from had no ablution facilities, neither did those markets have water. And also there were issues which arose on matters of healthcare. People were very concerned to say healthcare was beyond the ordinary person's reach because the public hospitals do not have adequate medicines, even though people go there for consultation, but they do not get any medication. They have to buy the medication, which is a very inaccessible point for the ordinary person who does not have the foreign currency needed to buy the medication. From Bulawayo, we went to Gwanda, and Gwanda informal economy workers also raised the same issues: lack of workspace, lack of ablution facilities, lack of access to water, and the compromised access to healthcare, and also the issue of childcare facilities for children of workers in the informal economy. To say there were no such affordable quality child healthcare facilities for children to go to whilst their parents were working in the informal economy. There was also the issue of harassment of informal economy workers by public authorities. This was raised in both Bulawayo and Gwanda. And from Gwanda, we then moved to Zishabane. And here, as we moved to Zishabane, national organizer Sibanda dropped off, and we were joined by the Treasurer General of ZCIEA, Mr. Maririmba, who is from Kwekwe. At Zishabane, very critical issues were raised pertaining to people with disabilities. People with disabilities raised concerns that the markets which were available were not user-friendly to people with disabilities, and there was also the consistent issue about funds or loans which were given out by government not having reached the informal economy workers or SMEs. In Zishabane, people raised concerns that these funds came out from Cholocho to Zishabane. In brief, the main issues or the long list of issues has been submitted to Parliament by our members through all these areas which we travelled with the Parliamentary Portfolio Committee, and these issues should be part of the national package. We shall be monitoring the process as it unfolds. Thank you.